it's Jessica DaMassa with WTF Health. I'm here in Sofia, Bulgaria at Webit, and joining me right now I have Paul Roberts. He is the CEO of GPDQ, which means?
GP, delivered quickly.
Got it. All right, and so you are UK-based, yes? You are a startup company?
Yep, that's right. We're a UK-based startup. We've got some operations over in the Republic of Ireland as well. International expansion is on the agenda, but we're UK-based for now.
Fantastic. And so what you guys are doing, very cool, interesting model. So tell me a little bit, you guys are basically delivering, you said primary care and telehealth and mental health services to people in their homes, more or less, yeah?
Yeah, exactly. For us, it's all about making it as easy as possible to see a doctor. And the way that most innovators have been tackling that is to build the solution around a technology silo. So to take video or to take home visiting or to take in clinic. And what we've done is to offer a service that cuts across all three of those in a joined up way. And also not only to make it about doctors, but to extend it across into physios and mental health so that we can really join up the whole of primary care.
That's fantastic. And so how are you guys, how does your model work? Because in the UK, you've got the NHS, so how does this work with the NHS?
Yeah, so yes, it can be quite complicated. There's a little bit of private self-pay, employers and insurers are involved. So although we do a little bit of private self-pay, and that's where we proved our concept because it's easiest to get to market. For us to scale, to really have a system-wide impact, we want to be free at the point of need, which in the UK involves working with insurers and employers for the private side and working to be commissioned by the NHS on the public side. And with the NHS in the public system, we have the double bonus of being particularly relevant for the elderly and the vulnerable and those who struggle to access primary care in a conventional way.
Very cool. So how big are you guys? How many users, I guess, or patients do you have using the system?
Yeah, so we've seen well over 10,000 patients since we launched. We've been up and running for 3 years. We work now with over 30 global insurance groups and a large number of employers as well in the UK. So yeah, we're absolutely at that scaling point and we're just in the process of doing a Series A reflecting where we're at.
Oh, fantastic. Are you out of an accelerator in the UK or are you guys kind of homegrown? How did you guys come about?
No, completely homegrown. So my co-founder is a GP and a doctor in the UK. So a lot of the inspiration and creativity has come from really wanting to fix the health system from the inside and to make life better, not just for patients, but also for the doctors who come and work with us.
On the fixing the health system from the inside side of this, I guess, walk me through that. So for anybody who's really not familiar with some of the challenges in the UK or the challenges of the NHS, I mean, in the States we have our own challenges. Here in Bulgaria they have their own challenges. But what are the particular health challenges that you guys are solving by taking this kind of general practitioner care and bringing it to people's homes, either via telehealth or via house calls? How is that helping?
Yeah, so it's all about access. So there's a cost to the NHS in the UK annually of £3.3 billion, which is the cost of people who end up having a stay in hospital when they could have been dealt with in the community with primary care. And that's really the nub of the problem that we're solving. And by removing those barriers to access, both for the working age population, which means that they stay healthier for longer, as well as the elderly, who are the main source of that cost, we're able to really reduce that bill, as well as obviously producing much better outcomes for the patients themselves.
And tell me this too, I know like in the US we talk about the primary care crisis, basically. There's just not enough primary care to go around. Is the UK facing something similar?
Yeah, absolutely. The average waiting time to see an NHS GP now in the UK is over 2 weeks. And that's a function of demand that just keeps going up and a number of doctors which keeps going down. So, to your point about the whole system piece, we're solving the access point for the patient. But we can also only do that by attracting and retaining doctors. And a really key part of our proposition is what we have on offer for clinicians. And we try really hard to keep them working in the UK by giving them work that is high quality and innovative, but also creating a sense of community around that, which all too often is lacking when you're a portfolio GP.
Absolutely. Well, Paul, thanks so much for stopping by. So Paul Roberts from GPDQ.
That's right.
Check it out, and good luck with your round.
Thank you very much.
Thank you so much. I'm Jessica DaMassa with WTF Health. Pleasure to talk to you too. Thanks so much for joining us.